Should parents have the right to say, "Let's talk about it"? I am Dr. K. Paul Stoller. Now imagine taking your child to the pediatrician.
The doctor says,
Your child needs surgery. Would you expect a discussion? Of course, the doctor recommends. You ask questions, you weigh the risks, you weigh the benefits, you decide together.
now imagine the doctor says,
Your child needs a cholesterol drug. Again, there's a discussion. Every important medical decision is supposed to involve one simple principle: informed consent, except for one category of medicine, childhood vaccines. People think my lawsuit against the CDC is about vaccines. It isn't. It's about medicine. Specifically, whether medicine should still be individualized. Today, the CDC classifies most routine childhood vaccines as Category A recommendations, universal recommendations for everyone in a specified age or risk group. My lawsuit argues that these should instead be moved into Category B, where the decision is made through discussion between physician and parent. Notice what I didn't say. I didn't say abolish vaccines. I didn't say ban vaccines. I said restore the conversation. Every physician understands that medicine isn't practiced on averages. It's practiced one patient at a time. Should this woman receive hormone replacement? Should this man start a statin? Should this patient undergo surgery? Should this elderly patient receive chemotherapy? Medicine has never been one size fits all. Until we reach childhood vaccination. Suddenly every child is treated as though genetics don't matter, family history doesn't matter, previous reactions don't matter, clinical judgment doesn't matter. The CDC's exemption framework focuses on a narrow list of recognized contraindications, while it does not account for broader, individualized risk factors or the cumulative safety of the full childhood schedule. That matters, because for more than 20 years, the Institute of Medicine repeatedly recommended further study of the long-term safety of the overall childhood immunization schedule. Those recommendations remain central to the complaint. The lawsuit asks a simple question. If we haven't fully studied the schedule as a whole, why should individualized judgment disappear? Here's what fascinates me. The Environmental Protection Agency studies cumulative exposure to pesticides. The FDA evaluates combination drug therapies. But my complaint argues that no comparable cumulative safety assessment has been performed on the entire pediatric vaccine schedule. Think about that. Everywhere else in science, combined exposures matter, except here. I exercise clinical judgment beyond the CDC's narrow contraindication framework and paid the ultimate price. I looked at genetics, family history, previous reactions, individual risk. California regulators concluded that wasn't the standard of care because it fell outside ACP guidance, a central issue raised in the complaint. My question has never changed. When did medicine stop being about the individual sitting in front of the physician? Whether you vaccinate every child, some children, or no children, isn't actually the issue I'm asking you to think about today. The question is much deeper. Who should decide, a committee or a conversation? The greatest advances in medicine have never come from demanding perfect agreement. They came from asking better questions. My lawsuit asks one. Should medicine remain individualized, or should every child be treated as though every child is exactly the same? I know where I stand. I believe medicine begins with one physician, one family, and one child, not with a bureaucratic category, because medicine was never meant to be one size fits all.